My OBGYN and my pediatrician are recommending I get or give my baby the RSV vaccine. Hi, I'm Dr. Brittany Todd. I am a clinical pharmacist and a mother of 4, and I want to talk to you about this RSV, quote-unquote, vaccine. First off, it is called Beyfortus. It's nirsevimab, and it's not actually a vaccine, even though it's on the childhood immunization schedule. It is a recombinant DNA monoclonal antibody. And the first thing I want to mention is usually monoclonal antibodies are made with or have been studied on aborted fetal tissue. I cannot find information, the prescribing information inserts, or on the websites from the manufacturer if there is in fact aborted fetal tissue. Usually it's human embryonic kidney tissue. I can't find it, which sometimes means they don't want you to know because a lot of people are more hesitant to take it because of ethics. Number 2, is it effective? And number 3, is it safe? And so number 2, efficacy. The MELODY trial looked at nirsevimab versus standard of care placebo, nothing. And they found a reduction in medically attended RSV, meaning how many kids went to the doctor to be treated for RSV. No difference in hospitalization. However, the HARMONY trial did find a significantly reduced risk of RSV-related hospitalization and non-RSV, just lower respiratory tract infections, think pneumonia. For those hospitalized with RSV, there were only 0.3% of kiddos in the nirsevimab group who were hospitalized versus 1.5% of kiddos in the standard of care group. So there was about an 80% reduction in RSV hospitalizations. But what I want you to pay attention to is the placebo group. It was only a 1.5% risk of going to the hospital anyway, so already pretty low. And with the medication, it dropped it to 0.3%, which is pretty good. And the number needed to treat to prevent one hospitalization was 77 kiddos. So that's not a bad number. Now let's look at the safety. There were no huge differences between standard of care, nothing, and nirsevimab. However, there were significantly more treatment-related events that occurred in the nirsevimab group. So 2.1% of babies had some form of treatment-related event versus 0 in the placebo group. So the risk of having some sort of adverse event to nirsevimab was 2.1%. But remember that the risk of having an RSV hospitalization was only 1.5%. So there was actually a higher risk of side effects than there was of hospitalization. Now, the side effects may not have been severe, and obviously it's not hospitalization. One other thing I want to mention clinically is even though there were more kiddos hospitalized in the placebo group, there was no difference in ICU or mechanical ventilation because it was still incredibly rare in both groups. So now you have informed consent.